Thank you for joining us for On Call for All Kids. Today we're talking all about breastfeeding. We'll be going over the benefits of breastfeeding, if moms can breastfeed when they have COVID-19, and advice on what to do if the baby is just not latching well. I'm joined by Dr. Prem Fort. He is a neonatologist at Johns Hopkins All Children's Hospital. And Dr. Fort, thanks for joining us.
Ashley, thank you for having me.
So we often hear the term breast is best. And so what are the benefits of breastfeeding?
So as we just celebrated National Breastfeeding Month, we do have to talk about the benefits of breastfeeding and breast milk in particular. We know that breast milk does decrease the risk of infections. We see it in newborn babies, in premature babies. It actually helps them decrease infection in the gut. It also helps babies that are born small to grow appropriately. We see it in children as well, not only with decreasing infection, but it actually helps them to decrease illnesses such as asthma and allergies. What's really interesting, and a lot of people don't know this, is that for adults who had been breastfeeding as babies, they actually have decreased risk of chronic illnesses, things like diabetes, obesity, and maybe even heart disease. So a lot of benefits to breast milk from all the way babies to adults.
So truly you're setting them up for hopefully a lifelong of health. That's great news.
Yes.
Now we're in the middle of a pandemic, Dr. Ford. And so are moms able to still breastfeed their baby, say if they are COVID positive?
So initially, the recommendation was if a baby was born to a mother who had COVID, the baby had to be separated from the mother. And you can imagine that was very stressful. Now, the new recommendations from the American Academy of Pediatrics state that the mother actually can stay with the baby and also give the maternal breast milk. Why? Studies actually show that there doesn't seem to be any infection that passes from maternal breast milk to the baby. Now, there are smaller studies that have shown little particulates or small pieces of viruses do pass through the breast milk, but they actually cannot cause infection to the baby. They're not live. They don't cause infection to the baby. So it's very safe to be able to use the maternal breast milk for the babies, even if the mother is COVID positive.
Is it just recommended that does she need to still wear a mask, good hand hygiene?
Absolutely. That's an important point. Yes. If the mother has COVID positive and she's with the baby, she must continue to wear her mask, wash hands before she touches the baby, use the appropriate care and as the guidelines state.
So can you explain to us, when does the breast milk actually come in preparation for feeding the baby?
So what's interesting is actually breast milk is already produced or can be produced during the second trimester, but there are two hormones, estrogen and progesterone, that actually keep it at bay. They keep it blocked. Now, when the baby is born, these hormones drop and it allows another hormone called prolactin to now substantially produce milk. But the more that the baby feeds, the more that this hormone goes up in your levels, and the more that the baby now is able to get higher volumes of breast milk. So this is why it takes a little time for this hormone to build up and for the milk to come in. Every mom is different. And so some moms are able to do this within the first day. Some moms, it takes up to 7 days for the milk to come in. And that is the variety that exists because of different moms and their bodies and their hormones.
And what if baby is just not latching on well?
One of the main things is actually to be relaxed and be comfortable when you're feeding a baby. The actual hormone that helps with the letdown, that helps the release of milk, called oxytocin, is inhibited when a mom is nervous or if there is fear involved. And so the main thing is to try and find a comfortable environment. You may need to turn down the light. Obviously, this works really well at night. And then this hormone will be able to be increased and allow for a really nice letdown of milk. The other thing, too, is to make sure that the baby's mouth is covering the whole areola, the brown part of the nipple, not just the tip. So if a baby is not latching well because it's just holding on to the tip, which obviously could be painful to the mother, too, you can gently put your finger in the mouth, detach, and then try again with the baby holding again onto the whole areola.
What can a mom do if she's just struggling a lot, especially for those new moms? They haven't been through this before. It can be a little bit daunting. What advice do you give them?
One of the things that you can do is that most babies that are discharged see their pediatrician within 1 to 2 days. And that's a nice moment to go ahead and talk about some of the difficulties you may be having as a mom with breastfeeding. Just approach the pediatrician, let them know you're having these problems, and they're trained to be able to talk about this. Some pediatric offices even have a lactation consultant that they can help you with these problems, or you can go to a local lactation consultant to help you with this. The other place you can talk to is when you go to your first OBGYN visit. They can also, the OBGYNs are trained to talk to you a little bit about lactating or being able to breastfeed and latching problems. And they in their office may also have a lactation consultant. You can look at websites such as the American Academy of Pediatrics. You can look at the CDC as well. And they also have resources that you can link up to give you information on if you're having problems with breastfeeding or latching.
Well, it's great to see you, Dr. Fort. Thank you so much for joining us and talking about all the benefits of breastfeeding.
Thank you again for inviting me to talk.
You can also visit our website as well. We've done a lot of articles and have some other resources about breastfeeding for you as well. That's hopkinsallchildrens.org/newsroom. And if you have a topic idea you'd like us to look into for On Call for All Kids, you can just comment below right here on this video. Thanks for watching. We will see you next week.